bon Dieu. Priez, 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 s'il vous plaît. Criez, 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 notre bon Dieu. Criez, criez, s'il vous plaît. Criez, 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 notre bon Dieu. Criez, criez, s'il vous plaît. Criez, 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 notre bon Dieu.
We're in Mirebalais, and we're at the doorstep of Partners in Health's flagship hospital, 320-bed facility that's going to open in a few months. This is one of the best facilities anywhere in the country, and we're very excited to be a part of it with Sir Richard's and with our Core condom brand. So we're going to go in and take a tour with our partners and show you the facility.
My name is Spahn, and I've been with Partners in Health for over 4 years. I am working as part of an operational team that is kind of an interim unit of about 7 people who are working on the operational planning process for the hospital.
The building has been constructed to kind of international building codes and standards.
205,000 square feet.
So if we walk over here, you can see a beautiful mosaic. You see a lot of couples that kind of walk by because it gets lit up at night and it looks very beautiful, kind of hand in hand strolling by the hospital. It's the new place to be, I guess. So. We anticipate having about 1,000 staff once the hospital is fully operational, which won't be at first, like I mentioned initially. So we'll have 2 of the 6 operating rooms will be open when doors open for the hospital, and then we'll eventually ramp up other services.
So, I mean, the hospital becomes a community anchor.
Yes.
Is that the idea?
That is the idea. And so we've been working a lot to try to think through and help kind of the city of Mirebalais do some planning, because the impact that this hospital will have on the surrounding community is going to be huge, and I think something that we can't measure right now, though we're trying to be able to support them in whatever ways possible. Cool. 1,800 solar panels on the roof, so that will be enough power to be able to run the entire hospital at full capacity during the day, and then we'll actually working on being able to feed any excess back into the grid, so we're also connected to the national grid.
So you expect the solar power to exceed your demand here?
Yes.
So you're also not only delivering healthcare, you're delivering energy to the area.
That is the hope, yes. We actually have 24 beds in this room. 11 of them are designated for delivery and 13 for labor. And then as you flow out of labor and delivery, you have the neonatal intensive care unit and postpartum, all within this very small corridor. Behind the nursing stations is where you have kind of med storage cabinets, which is also where Surgeon's condoms will be stored. And that's kind of when Chris was mentioning from the depot to all of the other dispensary locations. Behind all of the nursing stations is a dispensary station that they'll kind of control and manage and be able to kind of offer condoms and talk to both men and women about family planning options, regardless of their touch point in the hospital.
So when you say opt out, it's just the family planning conversations integrated in every point of the hospital.
Yes.
I mean, you would have the condoms all over the hospital, it sounds like.
Yes, we will. That is the plan.
When the stock of Sir Richard's condoms arrive here in Mirebalais, they'll be brought up to the depot where they'll be stored. And then they'll be distributed to the different wards, to the consultation rooms, to the pharmacies from that depot. So we'll make sure that we have condoms available for distributing to our patients in all these consultation rooms here.
So in every room there'd be just like a little bag or a box of them.
Yep.
Very cool.
Yeah,
part
just
of
how
the
we
stock
stock
that we'll
cum
have.
depressors, gloves, we'll have condoms in there as well.
Great.
Absolutely.
Yeah.
And this is a nicer exam room than my doctor.
Yeah.
It really
It's
is.
beautiful,
Yeah,
isn't
it's
it?
a beautiful room. Is there a demand then for more condoms here?
Yeah, I would definitely say so, and I think not only a demand for more condoms, but a very strategic way or plan to be able to get them out to the community as well.
Have you seen Core?
I have not. This
You
is actually
haven't
my
seen this?
first time.
All right,
No,
well, here
I'm
we go.
excited.
So this is the condom design and brand, and what's your reaction to that? Just his name and.
I think it's great as my first reaction.
Wow.
I think the coloration is perfect. I mean, the Haitians love bright colors, and
What about the back of it?
I think this is great because the context is very, very simple, and it will probably make people chuckle. But I think you find that people are really engaged in wanting to know how to use things and very curious at the core.